If you've ever gone to bed with a good reading and still woken up higher, you already know the night can be the sneakiest part of blood sugar management. While you sleep, hormones like cortisol and growth hormone rise, your liver does its housekeeping, and your morning fasting number pays the price. Tonight we're going to fix that with small, practical habits that add up. 7 simple night drinks that can support steadier glucose while you sleep. This is education, not medical advice. If you use insulin or diabetes medications, talk to your healthcare provider first, because even gentle changes can move your numbers. Here's the big picture in plain English. 2 levers matter most overnight: hydration and metabolism. Mild dehydration concentrates glucose. Rehydration helps your kidneys clear it. And certain botanicals and nutrients can nudge insulin sensitivity, digestion, and inflammation in the right direction. None of this is magic. Just tiny, repeatable nudges that compound over time. Start with warm lemon water. A glass made with the juice of half a lemon, sipped 30 to 60 minutes before bed, hydrates you and brings vitamin C into antioxidant pathways that help your body handle metabolic stress. Just as important, the ritual cues your brain that the kitchen is closed, which quiets late-night grazing. Keep it simple. No honey at night. And if you deal with reflux or sensitive enamel, follow with a rinse of plain water. Next, go with decaf green tea in the evening. Green tea delivers catechins like EGCG that support insulin sensitivity and overall metabolic health, while L-theanine promotes a calm, focused relaxation that won't leave you groggy. Steep a bag or a teaspoon of loose leaves for 2 to 3 minutes, then sip it warm about 1 to 2 hours before bed so you're not up for bathroom trips at midnight. If you take an iron supplement, separate the tea and your iron dose by a couple of hours. Another surprisingly powerful tool is a diluted apple cider vinegar tonic. The acetic acid in vinegar can slow starch digestion and blunt post-meal glucose rises. For some people, a small diluted dose in the evening also helps smooth the morning number. Mix 1 teaspoon, up to 1 tablespoon if you already tolerate it well, into 8 to 12 ounces of water and drink it right after dinner or 30 to 60 minutes before bed. Use a straw to protect your teeth, never take vinegar straight, and check with your clinician first if you have GERD, ulcers, gastroparesis, kidney issues, low potassium, or you're on insulin or a sulfonylurea. If you crave something naturally sweet and cozy without actual sugar, make cinnamon tea, ideally with Ceylon cinnamon. Cinnamon's polyphenols support insulin signaling, helping your cells usher glucose inside to be used, not left floating in your bloodstream. Simmer 1. Ceylon cinnamon stick in 10 to 12 ounces of water for 10 minutes, or steep a half teaspoon of ground cinnamon and strain. Drink it about half an hour before bed. The natural sweetness of cinnamon often satisfies dessert urges all by itself. For clean, easy hydration that tames evening cravings, keep cucumber mint water in the fridge. It's simple. 6 to 8 thin cucumber slices and a few mint leaves in a pitcher, chilled for at least 2 hours. Sip from after dinner until lights out. The cool freshness keeps you well hydrated. The mint settles your stomach and sends a subtle done eating signal to your brain. And the whole thing feels like a spa ritual that just happens to be good for your numbers. Number 6 is fresh ginger tea, a small comfort with big upside. Gingerol compounds may support insulin sensitivity and calm the low-grade inflammation that often makes glucose harder to control. Slice a 1-inch piece of peeled ginger and simmer it in 12 ounces of water for 10 to 15 minutes. A squeeze of lemon brightens it if you like. Drink it about an hour before bed and let the gentle heat loosen the day from your shoulders. If you're on blood thinners or bruise easily, keep your dose mild and clear it with your provider. Finally, there's unsweetened turmeric golden milk. Curcumin, the active compound in turmeric, supports a healthy inflammatory response and insulin sensitivity, and a pinch of black pepper boosts curcumin's absorption. Warm 8 to 10 ounces of unsweetened almond, soy, or dairy milk and whisk in a half teaspoon of turmeric with a tiny pinch of black pepper. A dusting of cinnamon adds depth without sugar. Sip it 60 to 90 minutes before bed. The warmth layers on sleep pressure, and the flavor makes it feel like a treat you don't have to feel guilty about. If you have a history of gallbladder issues, ask your clinician before making turmeric a nightly habit. Don't love one of the 7? Swap in chamomile or peppermint tea, both caffeine-free and relaxing, with chamomile offering a gentle nudge toward deeper sleep. Or keep it very simple with a warm cup of unsweetened almond milk. It's naturally low in carbs and brings a touch of magnesium and vitamin E. The key is consistency, not perfection. Build a rotation you'll actually follow. Monday lemon water, Tuesday decaf green tea, Wednesday ACV tonic, Thursday cinnamon tea, Friday cucumber mint water, Saturday ginger tea, Sunday golden milk. After 2 or 3 cycles, keep what noticeably helps your numbers and drop what doesn't. If one option clearly shines for you, give it 2 nights a week and retire a lesser performer. Drinks are only half the story. The other half is the night snack rule. If you truly need something to eat, anchor it in protein, fiber, and healthy fat with very low sugar and starch. Think a small Greek yogurt cup sprinkled with chia seeds, a handful of almonds or walnuts, or celery sticks with a tablespoon or 2 of peanut or almond butter. Pairing one of these with your drink reduces the liver's overnight glucose dumps and smooths the dawn reading. When should you expect to notice a difference? Sometimes within a few nights, especially if you track with a CGM or consistent morning finger sticks. The best way to learn your personal response is to try each drink for 3 to 4 nights in the same weekly slot and log a few basics. What you drank and when, roughly how many carbs were in dinner, your bedtime reading, your fasting reading, and how long you slept. Patterns beat single readings. If you wake up higher than you went to bed, try moving your drink a bit earlier, add a small protein-forward snack, and look at dinner timing. If your CGM shows a 2 to 4 a.m. rise, consider reserving ACV for your higher carb dinners or shifting green tea earlier in the evening. If reflux ever flares, lean on ginger or chamomile and keep lemon and vinegar away from bedtime. Safety always comes first. If you use insulin or a sulfonylurea, remember that anything improving sensitivity can increase hypoglycemia risk. So monitor closely the first week you experiment and coordinate with your clinician if adjustments are needed. A CV, ginger, and turmeric can interact with certain conditions and medications. When in doubt, ask your pharmacist or provider. Skip nighttime sweeteners, even natural ones like honey or agave. Your goals are steadier glucose and deeper sleep, and sugar undercuts both. Keep your nightly routine short and repeatable. Dim the kitchen lights to signal wind down. Brew or mix your drink with no sweetener. Take 5 slow breaths while it steeps. Lowering stress hormones helps glucose as much as anything you drink. Aim to finish your mug 45 to 60 minutes before bed. Set a water bottle on your nightstand to avoid late kitchen trips. Then let your routine do the work. Over a week or 2, you'll learn which options settle your line the most. If you try the 7-night rotation, report back with your results. What smoothed your overnight curve, what didn't, and what surprised you. Someone else will learn from your experiments, and you might discover that the simplest rituals, lemon water, a cinnamon stick, or a warm golden cup, make the biggest difference by morning. Sleep well and wake up steadier.